This is 17 News with continuing coronavirus coverage.
Good afternoon. We begin with breaking news at noon. Governor Gov Newsom is set to make a major announcement about the COVID-19 pandemic in California in just a couple of seconds. He says there will be a major initiative to increase California's healthcare workforce to combat a surge in coronavirus cases.
Now getting into the next
and let's take a listen in right now.
To begin the process of actualizing those plans in real time. Let me give people an update on where we are in the state of California. In particular, in the last 4 days, we have seen a doubling of the number of hospitalizations related to COVID-19. In the last 4 days, double the population that's been hospitalized. We've also seen a tripling of the number of ICU patients in our system in the last 4 days. These have long been projected based upon our modeling. Consequence, we have for weeks now been organizing ourselves around a surge that will require roughly 2/3 increase in capacity within our hospital system. That requires three fundamental things. It requires finding new places to put people. Number two, requires having adequate supplies from PPEs to the ventilators. And importantly, number three, requires people. And today we are announcing a new effort, healthcore.ca.gov, that will provide a platform to match individuals that may have retired in the last 5 years, may be in the process of getting licensed or relicensed, people that are in nursing schools or medical schools that are nearing the completion of those efforts, to incorporate and encourage them to get on this platform to provide for the kind of human capital surge that we'll need to meet the moment over the course of the next number of weeks as these numbers continue to rise. We couldn't be more pleased by the incredible professionalism of our nurses and doctors, our professional representatives that came together across many differences and organized around a framework of providing more flexibility, more surge capacity within the system, by providing scope of practice reforms, by allowing us to utilize our existing resources in a more resourceful way. I want to thank all of the representatives for putting aside, again, those differences and meeting this moment head on to provide the flexibility that is required to meet this moment. We have an executive order that went out that will provide flexibility through June 30th. This is temporary flexibility on staffing ratios, on scope of practice for nurse practitioners, EMTs, and others. We are going out now to deeply find the kind of talent, though, that is necessary beyond the scope of practice changes and beyond the regulatory changes, and to make sure that we have the adequate workforce, looking for mental health experts, looking for more EMTs, more pharmacists, looking for more phlebotomists, looking for more experts in respiratory care and the like, technicians, administrators, doctors, nurses. We are calling on you to step up and step in and meet this moment. We have more licensed healthcare professionals in the state of California than any state in the nation, some 766,000 professionals in the state of California. But we estimate we have the capacity to increase our ranks by an additional 37,000 plus professionals that are in that time of life where they, again, may have just recently retired, or they're in the process of getting their license and their degrees. And so we are very, very hopeful with this effort that we see a surge of individuals to be paid and compensated to participate in the workforce and distributed throughout our care delivery system all around the state of California. I will have an individual and representative here in a moment to talk more specifically about what that means, and also to remind everybody it's National Doctors Day in the United States, of stipends for individuals that need transportation funding, that need child care support, if they're going to participate in this workforce, that can get the kind of support on things that otherwise we wouldn't be paid for. Things not just like childcare and transportation, things like hospital, or rather hotel rooms and accommodations. So they put up $25 million, and we're very grateful to Facebook for providing those things to help us in areas where we need a little bit extra support. Again, that's the spirit of California. That's the spirit of this moment. It's the spirit that's driving our resolve. Driving that resolve as well is the aggregation of all of these physical assets that have taken place and shape over the course of the last few weeks. From the USNS Mercy that now took their first patients just yesterday in Los Angeles, to the 2,000 rooms that will be surging from the support of the federal government, these field medical stations. We already have our Santa Clara operation up and running. We have Riverside up and running. We have work being done in Los Angeles and San Mateo that will share some of that surge in San Francisco, part of the FMS process, again, already operationalized. Seton Hospital already operationalized that we brought into the portfolio of assets here in the state. We've been talking over the weekend to get St. Vincent, 366 beds in Los Angeles, fully staffed up as well. And we'll have some specific announcements on that in the next few days. Community Hospital down in Long Beach, we're starting to see that all take shape in real time. We have other hospitals we've identified in addition to the FMS sites in the USNS Mercy. We are also looking to get some 1,000 skilled nursing facility units up and running, and we have indeed made real progress in other areas from Fairview and Porterville, and now working with the Army Corps of Engineers that has now looked at 15 high-priority sites. They've got 4 more that they'll be looking at, from the Sleep Train Center here in Sacramento to Oakland Coliseum to the LA Coliseum and other sites throughout the state of California, looking at those sites as potential surge sites, all part of the plan to increase by 50,000 beds our available capacity within our healthcare delivery system. We have distributed now some 32.6 million N95 masks in the state of California. We have our sights on getting that 101 million that we have locked up into the state. And every couple days, more of that PPE comes in, not just N95 masks, but coveralls and shields and gowns and gloves, glove sets and the like. And so as soon as we get them in, we get them out. Yesterday, we were getting in a number of ventilators into Bloom Energy for refurbishing and reconfiguration. I'm very pleased the 150 that came from LA as part of the national stockpile, all of those have been completed and are done and are being sent back out into LA County. And I just want to encourage folks, if you have a line on ventilators, it doesn't matter if they're brand new. Maybe you have a few pieces lying around your basement or the house. I don't mean to be flippant. We'll take them. We've got the folks here in Silicon Valley that can do miracles with old equipment and refurbish that equipment. I just mentioned a few days ago that our community college system, they found 192 ventilators, not all of them in perfect shape, some of them used for training and the like, but we'll take whatever we can get. We currently have 4,252 ventilators that we've locked down. Our goal is to get to 10,000 ventilators. We're looking to procure new ones from around the globe, and we're hopeful that the federal government can assist us beyond the 170 that came into LA County. But if they don't, we'll be as resourceful as we possibly can. So on the physical asset side, that surge of 50,000 beds, we're making real progress. On PPE and lining up and identifying those needs, we're making progress, but still more needs to be done. But as it relates to personnel and people, nothing more valuable and nothing more potent to meet this moment. And so if you're a nursing school student, a medical school student, we need you. If you've just retired in the last few years, we need you. If you are looking to expand your scope of practice and have particular expertise in any particular capacity, we need you, and we encourage you take a look at that healthcore.ca.gov website. 5 simple steps. We'll ask you basic questions, and we'll help you with your relicensing. We'll help you with the protocols and processes to get you up and running and get you out the door so that you can support the needs of people of the state of California all throughout our state. We've seen an increase, a modest 8.3% in terms of the total number of positives last night, 5,763 total COVID-19 positives in the state of California. But it's those hospitalization numbers, it's those ICU numbers that we are most focused on. And again, those numbers are starting to go back up again along the lines of our model. So the next few weeks are going to be critical in the state of California. In the next few weeks, we're going to need more to flex and to surge and do more together to meet this moment. And before I turn it over to the doctor, I want to just remind people of how they can meet this moment. All of you that have the capacity to contribute can contribute most significantly by practicing physical distancing, by continuing the good work that we've done in this state, including over this weekend. We had to shut down all 280 parking lots in our state parks system. We saw a reduction in the kind of surge of activity in our parks and on our beaches compared to the previous weekend, but we want you to continue to do that. There's nothing more potent and powerful in terms of meeting this moment than practicing that physical distancing. Socially connected, let's be resourceful and addressing the needs of others. And I couldn't be more proud of our partnership with Nextdoor and the volunteers, some 8 million people they were able to connect with to check in on our seniors, to check in on people that are struggling with social isolation and may need not just food and medicine, but also may need a person to call, just check in and see how they're doing. So nothing more important for individuals if they want to contribute in this moment, that continue to do the incredible work you have done in the nation's largest state.
We just heard the latest from Governor Gavin Newsom, and he is urging any of those who are recently retired, finishing a nursing school, quote, they need you and they want you to help out in this dire time of need. You can go to healthcore.ca.gov. That's a website to find out more, and they also want to get you up and running by that. They are trying to increase the ranks by 37,000 plus in the healthcare professionals, and they have also, he talked about that they have distributed over 32.6 million N95 masks throughout California. They are looking for ventilator equipment as well. They said they will make it work, but their goal is to get about 10,000. So that is the latest from Governor Gavin Newsom at this time. And the latest on the coronavirus, there are now 60 confirmed cases of COVID-19 in Kern County. Kern County Public Health announced 8 new cases this morning. According to Public Health, 59 residents and 1 non-resident have tested positive for coronavirus. At this time, 33 of those who tested positive are from West Bakersfield, 11 in East Bakersfield, 11 in the Valley, 2 in the mountain areas, and 2 in the desert.
This morning, we have proclaimed a local health emergency for Kern County. This proclamation will be on the Board of Supervisors' agenda tomorrow for ratification, and this proclamation of a local health emergency accomplishes several goals. The first off, this gives the authority to issue orders related to communicable disease control. It also allows the ability to implement plans to work with partners to ensure targeted populations have access to health care, medications, and equipment to control the outbreak. And finally, this ability allows us to access resources from the state and federal government.
This local health emergency also means the county will receive emergency homeless funding from the governor's office, though it has not been specified how much. Kern Public Health also said it sent out 30 to 40 notices last week to local non-essential businesses who are not complying, asking them to close. Kern Medical's leader Russell Judd said they have a new plan that allows them to take in 40% more patients, but there is also a plan to put up an alternative care site at the Kern County Fairgrounds to help with an overflow of hospital patients. Chief Administrative Officer Ryan Oslope said the county plans to extend its emergency declaration past April 14th, so county buildings will remain closed, but essential services like water, sewer, and trash will still be operating. Another lovely day to kick off our work week. Let's send things over to Kevin Charette with a look outdoors.
Well, Nicole, it is a beautiful, beautiful day for Kern County as skies are starting to clear, and we're expected to be in the lower 70s this afternoon. In fact, the 70s are going to be on the board for some time, so that'll be a good thing for everybody. As you can see, I kind of made my way outside. Again, they've been saying that it's okay to make your way to the park. Just make sure you keep your distance. Let's take a look at the temperature right now. We're in the 60s for Bakersfield, 63 degrees currently, and just a light wind out of the west-southwest at 5 miles per hour. Overnight, we were at 45, pretty close to the normal, and our normal high today is 71, the record of 90 set back in 2015. Right now, you can see 50s and 60s into the valley, and we've got 50s into the mountains. Mojave at 63 right now. As we take a look at the satellite and radar, and it's not picking up much as we're starting to continue to clear and looking beautiful. There is a system out of the north. There's an area of low pressure of the Pacific Northwest, and that's going to meander there for the coming days. No impact on us. In fact, we're looking at 71 in Fresno today. Upper 60s, lower 70s out of LA and San Diego. And then you look up to the north and you can see that area of low pressure developing. Again, not going anywhere anytime soon. Now, I want to show you our futurecast because while we're tracking that system, by the end of the week and into early next week, we may see another system bring rain into our area, and you can see it right there. That's Sunday at 11 p.m., so I don't expect it. If it does arrive into Kern County, it'd be probably Monday. We're looking at upper 60s, lower 70s for you today. 71 in Bakersfield, 68 in Taft. For the mountains in the Kern River Valley, 56 in Frazier Park, 58 in Tehachapi, 60s for the Kern River Valley, 64 Lake Isabella, 69 though at Weldon. For the desert, upper 60s and 70s today, 69 in Mojave. Look for that westerly wind right around 10 to 15. As we take a look at the extended forecast, and 70s throughout the next 7, maybe a few high clouds coming in by the mid part of the week into the weekend, but still very nice. Overnight will be in the 40s, and then for the mountains, plenty of sunshine. 50s to lower 60s on your high, so nice and comfortable there. 30s and 40s overnight, and then for the Kern River Valley, plenty of sunshine for you as well. We'll look at 60s through next Sunday. Overnight temperatures will be into the 40s. So overall, a very nice forecast for Kern County. No rain right now, and gradually starting to warm things up. I know all of us have been a little bit of stir crazy, having to stay at home all the time. That's why it's kind of nice if you can venture out again to the parks, again keeping your distance, because the weather is just going to be perfect as we go throughout the next 7 days, Nicole.
Thanks, Kevin, for that. We're happy to have some warm weather. Well, stay with us. We'll be right back after this break.
KGET Business Watch is brought to you by Grapevine MSP Technology Services, the Valley's leading IT service provider.
Welcome back to your 17 Business Watch. People across the country and the globe are taking measures to limit the spread of coronavirus, avoiding crowds, working from home, frequent hand washing, and ordering in instead of eating out. But what about that last part? Is there a risk even if we have meals delivered? Mara Walker reports.
With most restaurants across the U.S. shuttered, many of us are turning to food takeout or delivery. But how safe is it?
My message around takeout really is go ahead and do it. It's a really safe alternative.
Dr. Benjamin Chapman, a food safety specialist at North Carolina State University, says there's no evidence that coronavirus is transmitted by food or food packaging, even if coronavirus somehow makes its way into your meal.
In general, eating food is low risk, and there has not been any evidence to show that coronavirus is transmitted by eating food.
And although the heat from cooking is more likely to kill off the coronavirus, Dr. Angela Rasmussen, a virologist at Columbia University, says the risk of contracting COVID-19 through a hot or even cold meal is extremely low.
Coronaviruses in general are not stable at high temperatures, so it is highly likely that cooking food will inactivate the virus. Cold foods, we don't know how long the virus remains infectious on cold foods. However, for things like produce that you would presumably wash prior to eating, that should rinse off any virus.
Dr. Rasmussen adds, if the virus is ingested, our stomach would actually get rid of the virus.
When you eat any kind of food, whether it be hot or cold, that food is going to go straight down into your stomach where there's a high acidity, low pH environment that also will inactivate the virus.
CNN's Dr. Sanjay Gupta says that if you order food from a restaurant, there are some precautions you should take.
What we've basically done is if we receive food, we'll try and take off some of the packaging actually on the porch even and leave it out there. And then when we come in, we sort of wipe any of the surfaces that any of the remaining packaging is on, and then obviously wash our hands. I mean, again, keeping in mind that it's hand touching and then hands to face. So that's how we've sort of approached it, and it seems to have worked. I feel pretty good about it.
Dr. Celine Gounder, clinical assistant professor of medicine and infectious diseases at NYU Bellevue, agrees that it's human interaction, not interaction with food, that poses the greatest risk.
I think the highest risk moment in getting food delivered to you is actually the face-to-face interaction, if you have one, with the delivery person. So ideally, you would be able to pay them online, tip them online, or whatever platform you're using for ordering food, and then have them leave it outside your door. Wait till they leave and then get the food.
If you prefer to head to the grocery store to throw together a homemade meal, wiping the products down and washing your hands are key.
I would suggest wiping down the external surfaces of canned or wrapped foods. You should be washing your fruits and vegetables, produce anyway. Soap and water is just fine for that. Making sure you sanitize your hands after you unpack your groceries is also a key step here.
Amaryl Walker, CNN.
And we now have a new date for the rescheduled 2020 Olympic Games, while some officials wanted them to take place next spring instead of next summer. Plus, London on lockdown, and some say it could last months. What the British Prime Minister is saying, those stories and more right after this. Welcome back. Taking a look around the world, a global update on the coronavirus this morning. There are now more than 752,000 cases of COVID-19 worldwide. Over the weekend, cases in the United States surpassed the number of cases in Italy and in China. This afternoon, more than 36,000 deaths have been reported globally. And the Tokyo Olympics organizers and the International Olympic Committee have made the final decision to reschedule the Games for July of 2021. Organizers are eyeing July 23rd, 2021 for the opening ceremony. The closing ceremony will be held on August 8th, 2021. Paralympic Games will be held from August 24th through September 5th, 2021. Some officials had initially proposed next spring as an alternative due to the Tokyo's hot summers, but organizers preferred a later date due to the uncertainty surrounding when the coronavirus pandemic will subside. And central London was nearly empty yet again this morning, a week after Prime Minister Boris Johnson's announcement that Britain will be put on virtual lockdown to combat the spread of COVID-19 concerns.
This is 17 News with continuing coronavirus coverage.